Hello again, everyone, and welcome to today's webinar. This webinar is brought to you by the Behavioral Health and Wellness Program, and this is the third webinar in our Whole Health Innovation in a Time of Uncertainty project series this year. Today, we are doing our Model Nicotine-Free Policy release. So this is really the culmination of this year of work, and we're really excited to have made it here to this point where we're on the precipice of releasing our Model Nicotine-Free Policy for use across Colorado and hopefully nationwide as well. So my name is Derek Noland. I'm a community liaison here at the Behavioral Health and Wellness Program, and I've been the manager of the various iterations of this project for the last 6 years. So I've had a lot of great experiences over this time and really excited about where this project can take us, this new piece that we've developed. Um, I do want to say that we will be looking to implement our model nicotine-free policy in new sites over the upcoming fiscal year that's set to begin July 1st. So if you are familiar with a behavioral health organization that might be interested in being involved in this work, please do let us know. We'd be most interested in talking to you. And I'll also be joined today by my colleague Jim Pavlik, who's our program and policy analyst here at BHWP. So he's been instrumental in building this policy as well as along with a lot of our tobacco work here with the local state health departments. And so I'm really happy that he's joining me too. So our training objectives for today, this webinar, the intent is to enable everyone to understand the rationale, the purpose, and the process that drove the creation of this model nicotine-free policy. We really do want people to understand why we felt that this was necessary at this time. And that really is in short because we need a more robust policy that includes all the new devices that have come out in this landscape and new challenges that are facing organizations. We really felt that it was time. It also aligns nicely with some both federal and state initiatives too. We'll also be discussing the components of the model nicotine-free policy and highlighting some of the more critical updates that we wanted to include. So we're going to walk through those contents and some of the key updates to this existing policy. Obviously, we won't get into extreme details today. We'll, of course, encourage everyone to look at this when we release it. And finally, we'll explain the utility of the model policy across diverse behavioral health treatment settings. And so we'll spend some time talking about how and where it can be used and our vision for the future and ultimately having a real user-driven functionality to provide some customizability to make it as applicable and valuable to organizations as possible. So before I get into the meat of the presentation, I want to bring everyone back to our project overview and our goals. So this slide is brought back from the first webinar in the series. Really, this initiative was to create the most comprehensive nicotine-free policy possible. So that really was our goal, and we feel like we've done a pretty good job in accomplishing that. We've worked very closely with the CBHC organization and its member sites. And of course, the Colorado Department of Public Health and Environment has funded this grant work, and the STEP program has been very valuable in helping us to do this as well. And so again, really, we do want this model nicotine-free policy to be able to be implemented both across Colorado and nationwide. We really want to keep Colorado at the forefront of this type of work. Okay, so let's look at creating a model, how we created this model free, or in creating the model nicotine-free policy, the rationale and purpose that we had for this. So we'll take a deeper look at why the project was prioritized and designed around this concept and what we aim to accomplish going forward. So our nicotine-free philosophy, this is another slide from the earlier presentation that I wanted to revisit before going forward. So our philosophy really is establishing nicotine-free policies and tobacco treatment services that are, as these are essential components in offering healthcare services. So our focus here really is on whole healthcare that of course would include tobacco treatment. It is a critical component that we offer this, in order to offer conscientious and comprehensive healthcare to our communities. It really does need to include tobacco and nicotine. So, taking another step forward, our nicotine-free policy does tie into existing policies that agencies may have, but this really is a focus expansion on one particular arm of offering whole health services, if you will. So, we really believe that avoiding nicotine and its excessive burden that it places on people all over the country is a critical component. It would be a disservice to our staff, our clients, our guests, the community at large if we did not address this. And we believe and hope that our policy has lived up to that goal. A little bit more background on nicotine-free policies. Um, Beyond the core rationale, there's a lot of additional reasons why these policies are both needed and valuable. You can see that there's a lot of benefits for clients in healthcare settings, of course, which perhaps is the primary focus and what we're most concerned about. Having these policies has been shown to lead to increased quality of life among these individuals. Likewise, as you would expect, we're seeing decreased disease, disability, and death, fewer hospital admissions, and things like that. Just from the healthcare industry perspective in general, we do see an overall return on investment with these policies when they're implemented. That may not always be immediate, but again, time and time again, we do see that it is there. There's likewise a lot of benefits for employees in establishing nicotine-free policies. Some of the things that we see are increased productivity. As people are presumably, um, you know, it, well, one thing I should say is that these policies do help a lot of people to quit tobacco or nicotine products. Sometimes it's the additional push that they need, and for that reason, a lot of people actually in organizations are in support of these, even if they are tobacco users, as they are hoping to quit and view this as helpful. And so we do see that increased productivity, which can come from a lot of reasons, just being healthier in general, having less smoke breaks, things like that, having more focus on the job. We see increased job satisfaction, and that could be for the reason that I mentioned about tobacco users wanting to quit, but also, of course, for people who are not tobacco users, perhaps not having any sort of exposure whatsoever to these products. Other things that we see, decreased hospital admissions. So similarly to clients, that's something that we observe in employees. We also see decreased absenteeism. So again, people being healthier and less likely to miss work as a result of these, and decreased presenteeism as well, in which people are present at their job physically, but perhaps distracted because they're thinking about their smoke break or navigating a craving or something to that effect. So a lot of benefits of these types of policies. So this is another slide from our earlier presentation. Wanted to briefly revisit the vision that we had when we set out on this project. Again, the goal here is pretty clear, to produce this updated nicotine-free policy for use across Colorado. And again, one of the reasons we wanted to do that was to reflect all the changes that have occurred in this industry. The rise of ENDS products, so electronic nicotine delivery systems, all the different electronic devices that exist in this market. We need to be mindful of them. Some of the traditional policies simply didn't address these in one way or another, and that can lead to a lot of complications with both enforcement and just navigating all sorts of issues around the policy. We also want to be cognizant of the increasing presence of marijuana, and so whether or not that's explicitly in a nicotine-free policy is something that organizations may need to decide on their own. Of course, marijuana would still be illegal in these settings, but we know that marijuana is often intermixed with nicotine solutions in these products, and so we get a blurring line there as well. Also, with COVID-19, we're seeing a great rise in telehealth considerations, and so it's another thing that we may need to be cognizant of in nicotine-free policies. Not having people being smoking during these sessions, for example, and also COVID-19 presented an interesting opportunity, if you will, in that a lot of people were and still are working remotely, and so. There is an opportunity to hopefully implement some of these policies as we're transitioning back into a more normal way of functioning, and that may be a good opportunity to do so. And of course, we want to make sure, as I mentioned, that Colorado remains a leader in this field. We feel that we're in that position and we want to stay there. So a little bit more background about the project rationale. This is aligned with the new CDC mandate to focus on behavioral health populations and policy work. So the CDC is essentially mandated state health departments to focus on this type of work alongside with reaching out to behavioral health populations, that focus. So it's a great initiative. We're really happy that this is developed, and we're thrilled to be in a position to be able to support that work. Likewise, there's a growing need to refine nicotine-free policies. BHWP, for example, we have had a tobacco-free policy toolkit, as we'll see, but it's really been about 10 years since we've done an extensive update of that work, and also since we've done a more expansive environmental scan of the policy situation in Colorado. And as we'll see, that was something that we did in this project as well. And so that's really what that third bullet point is about, is we evaluated where Colorado agencies have been standing with respect to policies. And as I was saying, we're setting the table to support this type of work in coming years. And as I mentioned, hope to find some new organizations that are on the cusp of implementing or expanding their policies. And with this new nicotine-free policy, we feel that we're pretty well equipped to support them in that initiative. So we're excited about that timing as well. And of course, I would be remiss if I did not mention this as well. One of the most important reasons that we're doing this may be obvious, but it's still worth saying. You can see here the behavioral causes of death in the United States as of 2017, the most recent data that we have. And you can see that tobacco in that left chart, tobacco alone causes more deaths than all of these other conditions in the right bar chart combined. So tobacco remains a leading killer in the United States, sadly. And so through this work, we hope that we can chip away at that number. I also want to call your attention to that dotted line on the left bar, and that represents the toll of death among people with behavioral health conditions. So you can see there about 40% of the overall tobacco deaths are people with this, people with behavioral health conditions. And so they clearly represent a disproportionate amount of these deaths. And we really feel like with better policies and treatment options and things like that, we really can start to move that down as well. Okay, so let's look at the process that we use in order to create the model nicotine-free policy. And while I'm going to look at the process in kind of a past tense sense, I do want to point out that we view this as a living document. We view the policy, that is, as a living document. And we recognize that this is something that will need updates as things change and the tobacco industry evolves moving forward. So just want to make that distinction. We will have this policy available for download, and still it's something that we want to view as ever evolving as the times dictate. And so I mentioned that we do have an existing tobacco-free policy toolkit, and this is still a wonderful tool that we have. It really provides a very clear framework for implementing tobacco-free policy toolkits, or for implementing tobacco-free or now nicotine-free policies. And so, this has been used to help hundreds of agencies to go tobacco or nicotine-free over the last decade, alongside our technical assistance a lot of the time. And so we had this great starting point to be able to take a step forward and create this model new nicotine-free policy. And this tobacco-free policy toolkit is still completely relevant and really helpful in implementing a nicotine-free policy. And so to take that thought a step further, these are the 10 steps that we cite in that toolkit in order to create a policy, the different steps that you need. And so today we really are zooming in on that draft your policy piece, that third one on the left. But all these other components remain important and really critical in successfully implementing a policy. So just to briefly overview these, it is important to convene a wellness committee, and that being focus not just on tobacco or nicotine and substances, but on general overall wellness, so that we're not, singling out any one substance and causing undue attention and stress around it. It's also important to have a change plan in place ahead of time going into this process of launching a policy. Of course, drafting the policy is a big part of this, and having a really clear and well designed policy is important. And so we're hoping that through this model nicotine free policy, we can really take that part and have it handled and really make it a lot more efficient and effective going in. Communication of the plan really important to all different people, your staff, your clients, any visitors, the community, neighbors. Being clear, being transparent, being consistent. These things remain very important. It's a good idea to build community support. Reaching out to neighbors, letting people know what your initiative is, and trying to think through challenges ahead of time. Some other things that you can do to supplement and reinforce and help the policy is to provide education about it, about tobacco, about treatment options, and also to offer treatment options. And so we'll see that these two components are included in the policy that we're releasing. Also, the launching of the policy is important. Having a date in which you're going to launch and announcing it ahead of time is important. Perhaps even having a practice launch date, maybe a month out, where you kind of do it as a trial to go through. And it's also important that you have an enforcement policy from the beginning. And of course, this model nicotine-free policy does contain one. And it's important that enforcement does occur. Most people are going to fall in line and not be any issue whatsoever. The vast majority, really. However, if there are instances of people breaking the policy, there does need to be enforcement. And finally, of course, we want to evaluate the program and continue to refine it over time. So all these steps remain critical, and hopefully we've taken care of the draft part to a large extent. Okay, so a bit more about creating the model policy. Here at BHWP, we did use a lot of, we lean on a lot of national leaders to get their input and their thoughts. So we collected different policies from different organizations. We evaluated them, looked for language and components that we liked. Of course, ultimately, this policy is our own. So I don't want anyone else, or I don't want any organization to feel that, we're misrepresenting their work, but they did influence our policy, and that was very helpful. And of course, the STEP program at CDPHE helped reviewing our draft and our nicotine-free policy, and made really good additions and edits that we've incorporated. So we really appreciate their help as well. And so since that step, BHWP has been finalizing the document internally. I changed that from finalized to finalizing because this is just a process that continues, and I don't want this to feel static. I do want this to be a living document, again, that we will be updating as we go forward. So an important distinction there. So some of the policies, just to recognize this work and to provide some clearer examples. We did get some good examples from industry leaders. The University of Wisconsin Center for Tobacco Research and Intervention provided some useful tools, some good thoughts about addenda to conclude. For example, different government organizations had really useful policies that we're able to scour and use some components there. Various tobacco education and tobacco control organizations, the Smoking Cessation Leadership Council, SCLC, we've worked with for years, was helpful as well. Different university and college campuses, a lot of them had, for download on the internet, different policies. So wanted to look to those two to see if there are other elements that we would wanted to include. And so all these different components came together to be part of this policy. I did mention that CBHC, the Colorado Behavioral Health Council, we also did a survey of the member organizations in that network. So there are 18 members in this network, and 11 of the 18 did complete this survey, and so this helped to provide a snapshot of where Colorado stands and the present in terms of the current policies that are in place. And we asked a few questions to get a sense of how robust the policies were, and also some open ended questions to see what sort of support might be needed, what thoughts the organizations had about the policy. And so we did get some feedback from them about the nicotine free policy. And so that was helpful and appreciated. Um, a few highlights from that survey that I wanted to share. Of course, all the agencies had comprehensive indoor policies that's mandated by state law. So that was as expected. We saw that 6 out of the 11 respondees had complete outdoor policies covering all their different campus grounds. So still some room for growth there. 9 out of 11 do now train new staff regarding nicotine policies at the agency. So pretty good coverage there. Still an opportunity perhaps to get that higher. Similarly, 9 out of 11 organizations provided or prohibited their staff from exhibiting evidence of tobacco use. So, not smelling like smoke, that was officially recognized. And that's something that we've wanted to be cognizant of in creating this. We saw that 8 out of 11 organizations had specific enforcement measures outlined. And so, as these are included pretty clearly in our model nicotine free policy, we hope that we can move that up as well. Some of the challenges that were cited in this survey were around enforcement and messaging. Those are always key concerns. So, again, hopefully, some of the things that we've included in our policy will help with that. And also having lacking a clear exterior policy was one of the challenges that some cited. On the other side, many organizations didn't feel like they had immediate needs at the time. A lot of them were, much more focused on COVID concerns, particularly at this time in last August when we did this survey. Those that expressed a need, about 3 out of 11, well, 3 out of 11 saw a need for technical assistance in this field. Okay, so let's look at the model nicotine-free policy itself, and we recognize it's everyone wants to see it, so we want to highlight the components and features, and we'll release this to everyone very soon. Um, so I do want to pause here for a moment to look at the layout of the NFP. So you can see there's different categories, if you will, and over the years we've moved up on this triangle. So originally it might be just a smoke-free policy, and so perhaps some smokeless products weren't included. And ultimately, a lot of agencies really now are at the tobacco-free policy, where that's where we've been for a long time. Whereas with the nicotine-free policy, we're now including all these different electronic devices and all those types of new additions that have evolved in this field. And so adding an explicit exemption for nicotine replacement products has been a big piece in this. You could even have another tier in the triangle above this, perhaps having a comprehensive drug-free policy. And so that's something to consider in the future as well. Okay, so some of the principles that guided the development of the nicotine-free policy, again, first and foremost, this is all about the health and well-being of everyone that any organization serves. So that, of course, includes the clients. It also includes staff, any visitors or guests on the property, and the community at large. And so the nicotine-free policy really is framed with this intent in mind. Of course, we have enforcement protocols as those are necessary in order to have an effective policy. But these are alongside treatment options. We want everyone to have the opportunity to get treatment, and so that really is what's guiding this policy. And so, ultimately, we are seeking to address addiction to nicotine as the best treatment practice, and to help people to focus on other challenges and so forth, and not have to be tied down by their addiction to nicotine. Okay, so a little bit more on the layout of the nicotine-free policy. Again, I'll just do some high-level overview here, and everyone will have the opportunity to see this very soon. Um, Kind of we lead in with this introductory material. So we have a rationale summary, a brief description of the policy. We have some considerations for version control and formal approval of the policy. So just some important components, kind of a snapshot where people can see um, this framework before diving into the meat of the policy. And then, of course, we have the nicotine-free policy itself. So this includes an expanded rationale and things of that nature. This includes the policy scope. So, what is covered, how it's covered, things of that nature. This is also where we include our enforcement principles. So, another key component there. It also ties into associated policies. So, a lot of organizations do have policies in place for all sorts of different considerations. And so, in some instances, it makes more sense to tie the nicotine-free policy to those as opposed to being redundant or even contradictory and covering them here. And so we've made an allowance for that in the policy. Um, Also, this second section concludes with a definitions piece. So we wanted to very clearly outline some of the key terms that occur within the policy so that we know exactly what's included in it, so that we can be as clear and prepared as possible. The third major section there is the nicotine-free policy associated protocols. So this is some of the things that are supportive of the policy. So we have information about the communication of the policy to, again, to both clients and staff and other parties that may be affected. We have protocols for education of new and existing staff and clients and so forth. We have protocols for the training of staff. Some staff perhaps being, well, all staff being trained in the very basics, perhaps, but then certain individuals being trained for uh, being able to provide more extensive services, such as being a certified tobacco treatment specialist or things of that nature. Um, we also have in this protocol section, our outline for addressing policy violations. So a very clear kind of tiered system that we recommend and distinct for both clients and staff, so that we can do that effectively. We also we outline all those different disciplinary components. And then we have the supportive nicotine treatment services tied to this as well. And I'm going to look at that on another slide in just a moment. So I'll just kind of skip over that for the time being. And then we conclude with two addenda that can be added to the policy. These are notices and acknowledgments of the nicotine-free policy. And I'm going to look at that in just a moment too. So I'll table that for the moment. Okay, so that's the very high level overview of what's contained in the nicotine-free policy. I now want to focus on some of the critical updates, so some of the key features that we felt were needed to make this as robust and effective and comprehensive as possible. So I'll begin this section, and then I'm going to turn it over to my colleague Jim Pavlik to finish it off with some of the other critical updates. Okay, so I mentioned that we have very clear enforcement protocols here. So, so these really are progressive disciplinary actions that are outlined um, distinctly for client and staff violations. So those do look fairly similar in that they each progress in a first through fourth offense. The first offense, generally it's just a reminder about the policy and letting people know. As this progresses, we do take more steps with staff in particular. We have a memorandum of expectation that starts to be documented and signed by both the staff member and their appropriate supervisor. So we do want to have that level of documentation in it. Clients similarly, we felt that with organizations having a lot of different systems, we simply wanted to state that these violations as they progress would ultimately be recorded in the client records. So that's how we've handled that piece. Um, but but I do want to point out that bottom bullet point again, as it really is important in how we're envisioning this. we do want violations to be treated as an opportunity. That really is the goal here. We want to be able to educate, whether it be client or staff. We want to educate them about the dangers inherent with nicotine use, and also we want to educate them about the treatment services that are available. So while we have this enforcement protocol in place as it is needed, it's not really what we want to be focused on. We do want to first and foremost try to help people to quit their nicotine use if they're you know interested and willing in doing so. And so those supportive nicotine treatment services are again explicitly in the policy and tied to this. So we set a clear plan to route clients to nicotine treatment. So a screening and assessment and a brief intervention is available to all. We want that to be standardized and done with every encounter. Um, and the gold standard here would be to have individual and group counseling available, as well as pharmacotherapy options in order to treat physiological addiction to nicotine. Other components of this supportive nicotine treatment services piece is having all staff again educated about the nicotine-free policy itself and tobacco products in general. We do want all of our staff to have a baseline understanding of the policy, its purpose, its rationale, the reasons why we're doing it, and to have a basic understanding of different tobacco products. And then again, as I mentioned, specific designated staff would receive additional training in order to be able to be the more extensive piece of this arm, as you will. So, um, in order to offer more services. And so there will be an opportunity in this policy as well for staff to receive nicotine treatment services too. And in recognizing that can be a complicated matter, we do have some human resources, related considerations in the policy as well. And so finally, specific to the policy itself, the notice and acknowledgement of the nicotine-free policy. So we have these are really addenda that are at the end of the policy that organizations can add as applicable. We have two different versions of these notices for clients to sign and date. We have one for residential and one for inpatient programs, and they do look fairly similar, but just a couple of different allocations are made for those slightly different settings. And so it includes a brief overview to let people know about the key policy components and also the rationale for the policy, letting them know about expectations ahead of time, and also the potential outcomes should they, repeatedly violate the policy or something of that. And so these addenda are things that organizations can add and to that way formally inform clients of the policy and rationale and have that information documented. And with that, I'll turn it over to Jim to highlight some of the other critical components that we have.
Great, thank you, Derek. And I made this point in the chat box for those of you who are able to simultaneously follow along, written and orally. One of the things that's being really updated here is our old policy. The toolkit that Derek mentioned, we wrote in 2015, and what are the differences between now and then, right? And we've seen that the landscape has shifted under our feet, and we just need to be more responsive to some of those changes, including some of the things that Derek's already mentioned, right? The growing use of non-combustible items, which include traditional e-cigarettes, the Juuls, and now we're moving into these heat-not-burn products. We also want to recognize that recreational marijuana is being more and more legalized across the country, and we want to make really explicit that these sort of Clean Indoor Air Act policies can be associated with our tobacco-free policies and vice versa. And we really want to sort of wrap all these things up together. And with that in mind, one of the things that we have always run across as we've delivered, used our tobacco-free toolkit or trained on our tobacco-free policy toolkit is this question around integration. How do we make these policies make sense? And one of the things that you've probably heard us say if you've been to any of our trainings for our group curriculum or our tobacco treatment specialist training is we really don't want tobacco to be in a silo. And that's true. We don't want tobacco in a silo. And we also don't want our tobacco-free or our nicotine-free policy to be in a silo either. We really want to make the point to the staff and also to leadership, to the extent that we need to make the values-based case. We really want to make the point to the staff that the nicotine-free policy is a logical extension of the mission, our organization's mission statement, and also it expresses the values that we say that we abide by, that guide us. And I mean, if you go to any behavioral health organization's website and you read their mission or you read their value statements or their vision statements, it's quite obvious that supporting nicotine freedom is always aligned with that. And we really want to make that case really obvious. And so we envision the nicotine-free policy as being an extension of the clear, comprehensive, and consistent pattern that we really want to enforce.
Jim,
And
sorry to interrupt. Someone's point out that you have a Zoom box that's blocking part of the screen with our the user.
let me try to reshare. You shouldn't be seeing my Zoom boxes at all. So let's try something else here. Is that better?
Yes.
Okay.
Thanks.
Thank you for that. With that in mind, we always talk about strategic alignment. And one thing I don't normally say is that this is not a strategic compromise. This is not a situation where we do the nicotine policy just because we can, or because it's in some way separate, but we kind of want to do it anyway. And that by doing nicotine freedom, we are shortchanging other elements of our mission. That's not the case. This is a situation where aligning our larger mission with nicotine freedom actually helps us achieve our mission, or the organization's mission. And it's this whole idea of interweaving it really serves, or it's associating our nicotine-free policy, the actual policy statement, along with these other associated policies, really serves several functions. And one of them is it's going to weave nicotine freedom and the nicotine policy throughout the organization. It's going to help it sort of infiltrate and accrete to the rest of the organizational mission, which is in the long term going to make it harder to not enforce. It's going to make it harder to take back out if we sort of like lose our willingness to do it. Which is to say that this is really associating our nicotine-free policy with pre-existing policies is really a way of our sustainability planning. It's also going to philosophically link nicotine freedom to pre-existing goals, strategies, and tactics. I mentioned it's aligned to our mission, but it's also really the nicotine-free policy really is aligned with all of these other initiatives as well. And so it helps us psychologically make the case that this always belonged here, right? And then finally, it's also going to make elements of the policy, the nicotine-free policy, easier to understand by saying we're not adding anything new, right? This part of the policy, this enforcement procedure, or this therapeutic termination procedure, or this progressive disciplinary procedure, these are all things that you already understand because they already existed. And here's a reference to it, right? It just guides them back to parts of the employee manual that they've already read. The associated policies that we make direct reference to in the model policy are the ones that are on the board here. And in some cases, we just assume that our organizations already have them. For example, search and seizure or contraband policies. We don't provide you language around contraband policies, but because not every organization has them, and those that don't have them aren't going to add them because of their nicotine-free policy addition. And those that, which is all to say, we want you to, if you have a contraband policy, we're going to make a reference to it, and we want you to go then edit your contraband policy to include tobacco or nicotine products to it. And in some cases, we actually do include some of the model language for some of these associated policies, specifically those bottom two, which is because almost every organization has a progressive disciplinary policy, but we wanted to provide you what a tobacco based progressive disciplinary policy might really look like if you needed to incorporate new language. But these are the policies that we are recommending that you look for as you adopt a new nicotine-free policy. And the way that we recommend that happens is through a policy review. The committee that's responsible for adapting or adopting a nicotine-free policy would actually spend some time going through all the existing policies and looking for which ones nicotine should be added to, and which of the also looking at these other policies and borrowing language as they see fit to adapt the content of their nicotine-free policy. There may be other ones, and we're going to be talking about some of the sort of the modularity that we built into the model policy. Along with the modularity, one of the rationales behind the modularity is that we really wanted the policy as it exists to really be modifiable for a lot of different care settings. So I'll just kind of dive right into that. And we started with the behavioral health care setting because it is one of the more difficult ones. So it is modular, and what we mean by modular is that it is written in sections, and we sort of have these sort of conceptualized into different levels in their relation to the policy statement itself. And I'll get into that in a little bit more detail. The idea being that if you don't like this aspect, if you don't like that scope, you can just change it to fit whatever your enforcement willingness or capacity is. We do want it to be adaptable down toward the most difficult setting for implementation, and then working up from there. And again, I'll talk about that in just a second. And we started with behavioral health. And before I get into what makes behavioral health care settings, in my opinion, the most difficult setting, it is worth pointing out that there are some advantages. There are some strengths that behavioral health care settings bring to adapting or adopting a nicotine-free policy. And one of them is the bona fide exemption status. If those words mean something to you, then you know what I mean. If they don't, it's maybe not worth it to go into much depth. This is not lawyerly. This is not legal advice. I'm not a lawyer, so I don't want to give you legal advice. But it is the case that that the tobacco companies have gone way out of their way to build up this idea of a worker's rights to smoke, or an employer's right to smoke, employees' right to smoke. And so even when an organization wants to adopt a smoker exclusion, they'll say something like, we're not going to hire people if they are smokers. The tobacco companies have really fought hard to make it illegal for companies to do that. And then on the flip side of that, within healthcare settings, the good guys have argued that there should be a bona fide exemption when smoking or tobacco use actually interferes with the provision of a good or service. Then you can add that smoker exclusion. You can say, we're not going to hire doctors that smoke. We're not going to hire nurses that smoke. Our actual policy does not recommend adopting a smoker exclusion, but if you wanted to, this is actually a way that makes it much easier for organizations to adopt these pretty strict nicotine-free policies. Another one is that it's pretty obvious in most healthcare providers understand that they are role models for their patients, and they need to model good behavior. And so they actually have a sort of intuitive understanding of why a nicotine-free policy is beneficial for their organizations to adopt. And finally, there is a little bit of myth busting that needs to be done around certain employees sometimes smoking with clients as a way of building rapport, but we can easily make the case that we do need to be modeling good behavior, and that this is not a good way to build rapport. So we kind of use the pre-existing sort of contradictory behavior to actually make a better values-based case to saying that there are better ways to build rapport. So these are sort of ways into behavioral healthcare settings to argue for our tobacco-free policy adoption. There are ways in which behavioral health care sites are actually a lot more difficult. And one of the reasons that they're so difficult is that they're rarely one organization or one type of organization. They normally have at least 2, sometimes 3, sometimes 4, 5, or 6 or 7 different service lines offering services at different levels of intensity, and that actually complicates the deployment of a single policy. And so we actually used this sort of diversity of service provision as a way of helping guide us into which components of the policy we considered core and which we considered supportive or addendum. And one I want to really just point out is that, and one of the reasons that we're still sort of in the editing phase and will likely be in the editing phase forever, are things like telehealth. And telehealth isn't brand new, but it certainly took on a much more prominent role in behavioral healthcare settings over the last 18 months or so. And as a result, we want to make sure that there's some specific language regarding how do we write tobacco-free or nicotine-free policies when some of the service provision may not even be person to person, it may be over a video screen. And so these are some of the considerations that we want to keep in mind. And I use what's called sometimes it's called the curb cut phenomenon. I always refer back to the OXO potato peeler situation. Several years ago, the kitchen utensil brand OXO developed a potato peeler for use by individuals with arthritis. And individuals with arthritis can't really bend their fingers as much as, say, non-arthritic individuals, and they also lack grip strength. So they made big fat handles with extra grippy material in them. And what they learned almost right away was that everybody loves that potato peeler. So they designed it for somebody with very specific and unique needs. But what they found out was that almost everybody benefited from it. And that's sort of what we're doing too. We wanted to design a tobacco-free policy, nicotine-free policy that would work for the hardest to reach service area. And then if you can get it there, then you can sort of deploy that same policy pretty much anywhere else. I do have this headline on this of this slide written as a question: which service level is most difficult? And in our experience, if you're an individual in a behavioral health care organization right now, you probably already have an opinion on this, and your opinion probably seems really obvious to you. But what I've learned as we've helped organizations go tobacco or nicotine free is that every organization thinks that a different aspect of their service provision is going to be more difficult. Residential is hard because people are there for 3 or 6 months or longer, and this is their home while they're there. And organizations have, feel bad about depriving individuals of certain kinds of legal freedoms, quote unquote, in their home. And I understand that. And for those organizations that really value that patient level freedom, that's the most difficult spot. However, other organizations think that outpatient is more difficult because people are in and out, they're in and out really quickly. What's the point of enforcing such a strict measure on them when they're only there for an hour? Other individuals or other agencies think that they're urgent or emergent care sites, what we would maybe call detox or acute withdrawal management, those sites are difficult because people come in extremely agitated states, et cetera, et cetera. I'm providing all these examples, especially for those of you who are thinking of engaging with behavioral health organizations to help them adopt these sites, that we can't go into their organization knowing which site's going to be the most difficult. But once we help them figure that out, what's going to be most difficult for them, then we help them design a policy for that site so that they can then take that site and modularly design a single policy to go across all different sites and service lines. And this is what I mean by that. So we start with the policy statement, and if you go to any tobacco-free policy, model policy, example policies, you can download these all across the internet. You can ask for samples from different organizations you're working with. This is what you typically find. This is what you will find in our current tobacco-free policy toolkit on page 32, going to I think 35 or 36, something like that. It's just this policy statement, but this is not how policies exist in an organization. Most of them have what is also called a policy summary. There's also all this weird reference material. Every organization has their own standards for how they write policies. Our new model policy includes all of that, so they can pick and choose even some of these weirder functions like version control and notes and history and all that stuff. The policy summary is the short or the brief version of the policy statement. And we wanted to show you an example of how a policy summary and a policy statement coexist so that you can see how one of these creates the other and then how they inform one another. The point being, you may adopt our policy statement and write a completely different policy summary if you want, but if you don't want to, then you can just use our example. We've already alluded to this several times, but then we also included several associated policies, some of which The language of those associated policies will inform the content of the policy statement, including reflecting certain organizational values unique to the site they're being deployed in. In some cases, the nicotine-free policy will inform the language of its associated policies. If you are tying in, for example, language directly into your tobacco or your nicotine-free policy, that it furthers the values of your organization, which is a move we highly advocate for. Maybe you want to go back to your other drug policies and change those policies so they also reflect a commitment to those same values. So you're further uniting the nicotine-free policy with these other drug policies you have. And in most cases, your associated policies are actually going to inform each other, and they're going to be edited and revised on the same schedules. As Derek mentioned, we also have a lot of policy support included in our actual model policy. These are things like the organizational obligation to provide education and training around the provision of tobacco-related services, as well as providing cessation services to staff. We consider this part of the support of the policy, and I'll talk about that very briefly in the next section. And then unlike a lot of other model policies, we actually include a lot of enforcement protocols and procedures, actual language and procedures around how you might try to enforce these policies. And we included them because people ask for them over and over and over again. So if you're in the business of approaching behavioral healthcare organizations or other organizations and saying, hey, we want to adapt your current policy, we want to improve your current policy, or we want to add a policy because you don't have one, there's going to be a lot of questions around how enforcement works, what it looks like, and we provided some of that language as well. And then finally, we also included, as Derek mentioned, some addenda, and these addenda inform both the policy itself as well as helps us with the enforcement side. And then because we are constantly saying this is a modular policy, pick and choose, add some of your own variables if you need them. We also want to recommend aligning the adaptation process along with what we would normally include the guiding principles for designing a policy from scratch and also executing the actual process. So you're always making sure that the language of your nicotine-free policy is internally consistent as you're changing things from the model. We want you to make sure that you're changing it everywhere it matters, but also making it consistent with your other policies, that the process of adapting the policy or adopting the policy is both transparent and bidirectional. You're never hiding anything. You're never putting anything in a closet, acting like you're ashamed of it, but then also explicitly asking for feedback from the people who are going to be impacted by your policy. So I think that more or less, I did want to say, and I seem to be missing a slide, but that's okay, I guess. I do want to say that because I told Maura I was going to approach this in the during my section, but I lost a slide. This really is a sustainably oriented policy, which is to say that a nicotine-free policy is sustainable so long as it's enforced. And Maura in the comments or in the chat box mentions that the language of enforcement seems really scary, and that is actually my experience as well. People really balk at the phrase or the term enforcement. It sounds really dictatorial, and it sort of seems to violate the sort of caring value that these organizations really try to model. I don't like to shy away from that word because it really is. That is what it is. Every organization is going to be different, and if they have other words that they use for other how they handle other violations of other policies, then by all means change to that language. My default position is to introduce enforcement early and to say it a lot, to inure people to the word so that it isn't scary. Because if it's done appropriately, if you follow the steps in our nicotine-free or tobacco-free policy toolkit, if you sort of add the psychological elements of the current nicotine-free model policy, you really diminish how much resistance you're going to get. It's making the case for itself through proper design. And then to the extent that there are people who are going to violate the policy on purpose or by accident, then there are reasonable and compassionate steps that we can take. But that is enforcement, which is all to say that a sustainably designed nicotine-free policy is an enforceable and enforced policy, and any policy that is enforceable and therefore enforced is also going to be sustainable. These, in this particular world, these are really almost synonymous terms. And with that, I'm going to go ahead and turn the slides back over to Derek to close us out.
Thank you, Jim. And so with this last section, I want to talk about the functionality of our model policy and our user-friendly customization. So this is a forward-looking section of what we hope to establish in the coming weeks here. To be more clear, the vision for our customizable policy is to have a platform in which people can choose the components that they feel are most valuable and applicable for their community. So first, I should say that the comprehensive, complete model nicotine-free policy that we will recommend and hope that people choose to use will be available for a free download on our website. We'll be looking to get that up there in about a week. And so this will be a comprehensive policy, again, that will be used both in Colorado and nationwide. So the next steps, ultimately, we do want to have this customization feature where it will be hosted on BHWP's website. Agencies will be able to come in and sort of use a user-friendly drop-down type of feature and basically select the different components that they would want to include. And so we've built the policy with that framework in mind, and this process is in the development, and we hope to have this completed before too long. And so ultimately, we hope that we can also provide a tailored policy for people to then be able to download and use at their organization. So for example, maybe they wouldn't want to include the addenda because those aren't appropriate in their settings, or maybe maybe they have their own enforcement protocols and don't want to include those and want to use their own. Maybe they don't have the ability to offer all the different nicotine treatment services that we outline, and so they could not include all of those in their customized creation. And so that's our vision. We're figuring out the logistics, and we're getting that put together, and we'll be able to offer that hopefully before too much longer. I also want to mention that all 3 webinars from this year's series of the Whole Health Innovation Time of Uncertainty project are on our website. We'll be getting this current presentation up there pretty soon as well. So if you'd like to review any of the previous ones, they're available there, as well as some other information about the policy. And so finally, here I want to encourage everyone to sign up to receive the model nicotine-free policy. And so our plan is to have this available for the public on Monday. There's just a tiny bit of tinkering that we want to do. And also the reason why we wanted to have people sign up for this is that hopefully we might identify some organizations that would be interested in working with us over the next fiscal year and to get some technical assistance and perhaps training opportunities in order to more effectively implement the model nicotine-free policy. So please, if you would like to receive the policy when released next week, just go and this is just like a 5-question survey, basically just asking for your name and your organization and title and so forth. So hopefully we'll identify some sites that might be interested in working with us in the next year. And with that, we're just at time, but I wanted to see if we had any questions before we conclude for the day.
Maura, we will definitely be in touch. I think I owe you a phone call or an email anyway.
Oh, great. We have a lead.
Ellen, to your point, our old policy did have, it really had like a very simple nod. It said like employees seen violating the policy would be go through the disciplinary course of action. I'm paraphrasing off the top of my head, as defined by human resources, blah. That's more or less what it still says, but now we've actually included what a progressive disciplinary course of action looks like with a 4 or 5 step procedure.
And Becky pointed out that we should put that in the chat. So I'm getting that link right now so I can copy it more easily. And there we go. Okay, so everyone, now in the chat box, I've just posted the link to that survey that we had to sign up to have the policy when it's released.
So I know that people are going to be logging off now. One of the things I do have in mind, and Derek and I have tossed around this idea a little bit, and if y'all are interested, one of the things I would like to do after we've actually released the text of the policy, which will be soon, is have maybe spend an hour, like another webinar, but maybe a little bit more interactive in how we actually take the model policy, the model language, and adapt it for specific organizations. It would have to be that sort of like a here's the pretend organization sort of deal, like how would you modify this language to meet this business's requirements. But if that's something that would be interesting to you, it's something you think you'd register for and attend, let us know, because we're tossing around the idea of whether or not we'd want to engage in something like that, like a workshop, basically. You don't have to let us know in the chat. You can just send us an email or something.
So any final questions? I know we're over 11, so last call, I suppose. All right, seeing none, I want to thank everyone for joining this webinar today, and look forward to talking in the future, and hopefully your agencies will benefit from this policy in the near future. All right, thank you, everyone. Have a good day.